Hi, I'm Jennifer Smith from the Coping with Depression blog at healthyplace.com. And today I'd like to talk to you about coping with a crisis or a family emergency when you have depression. Recently, my husband had to have an emergency open heart surgery. And while that was completely unexpected, I'm thankful that I already had some therapy and also some antidepressants on board to help me cope with that. In addition to those, I made sure that while I was at the hospital staying with him when he was able to be put into a regular room once he was released from ICU, that while I was caring for him, that I also made sure to do things to take care of myself. And that is absolutely not selfish. You've got to practice your self-care even while you're caring for your loved one, and most especially while you're caring for a loved one in a stressful situation such as the one I was in, caring for my husband after his open heart surgery. So some of the things that I did just to make sure that I had some self-care practices in place were to bring my pillows from home and my comforter from home, so that when I had the little pull-out bed to sleep on when I stayed in the room with him, I had those comforts from home. I brought a book to read. I brought a magazine to read. I made sure to have my regular hygiene items, even my makeup, just things like that that could keep me on a regular routine as I took care of him, as much of a routine as possible when you're staying in the hospital. Also, other things I did were to take people up on their offers to help. When people said, "What can we do to help?" I would actually tell them, "Hey, we are tired of this hospital food. Could you pick us up this particular food and bring it by? Could you come sit with him for just a few minutes so I can, get out, run, go get a coffee, just look around at a store," just simple things like that. Now that we're home, we have people that have offered to bring us meals. Once again, I'm taking them up on that offer. We've also had people that have offered to come and stay and help. My mom is here to help care for our child with severe special needs that you've heard me talk about before. Because as you can well imagine, caring for my husband now after this open heart surgery while also caring for a child with significant special needs would be quite an overload for one person. So my mother has graciously offered to stay. So I've taken her up on that. So if I could tell you one thing to help you as you cope with a severe crisis or family emergency, just remember that you must practice your self-care even in the midst of caring for a loved one. Again, I'm Jennifer Smith from the Coping with Depression blog at healthyplace.com.